welcome everyone. As you know, today's topic is helping healthcare fulfill its promise, how private equity can play a role in transforming the healthcare industry. My name is Vishesh Raisingani. I am the contributing editor to Mergers and Acquisitions magazine. We cover mergers and acquisitions across several industries and analyze deal making across the economy. And that's why today's topic fits right into our purview. It is my great honor to introduce our moderator today, Dr. Matt Brubaker. Dr. Brubaker is the chairman and CEO of FMG Leading, a healthcare advisory firm that helps its clients build high-quality, high-performing organizations. Matt brings invaluable insights into growth strategy, senior team alignment, and enterprise-wide change. With that being said, let's dive right into the conversation. Matt, over to you.
Well, thanks, Vishesh. Great to be here with you all today. And again, my name is Matt Brubaker, the CEO of FMG Leading, and my colleagues here today. Delighted to have you with us. I'd like to start the conversation by just giving each of you a chance to tell us about yourselves. That includes who you are as an investor, why you found this field, and a little bit about the firms that you represent as well. I'll start with you, Anna.
Hi, everyone. Thank you for having me, FMG team. It's a pleasure to be here and to be here with Lauren. I know Heritage is a firm that we love partnering with at Town Hall, so it feels appropriate that we're here together. So how did I find myself here as an investor? I was reflecting on this question coming into the panel, and really the way that I think about myself at my core is I'm a lifelong learner and I'm a curious person. Why that led me to investing, I think first and foremost, is I love asking questions. I'm the child of two journalists, and from my earliest days, we were raised to ask questions, ask hard questions, and be curious about the world around us. And I think that, in perhaps a not necessarily linear way, but a parallel way, led me to investing. And now, how did I end up as a healthcare investor, and specifically here at Town Hall? I feel incredibly privileged to be able to do my job every day. At our core at Town Hall, what I get to do is shepherd and accelerate and hopefully help drive the incredibly ambitious, mission-oriented entrepreneurs and teams that I have the privilege of working with every day. It's amazing to see what incredibly mission-oriented and talented people can do, how they can bring people along with them, how they can convince enterprise customers to take risks and to partner with them to really accelerate change. And that is at the core of why I love getting to do the work that I do at Town Hall. And so maybe a moment about Town Hall and what it is that we do here. So our core thesis is, as we think about the universe of healthcare opportunities and healthcare investing, what we really believe is the largest opportunities in healthcare are those that aren't just moving the needle, but totally rewriting the book for medically vulnerable and underserved communities. We know we have amazing models of care in this country, the best models of care in this country. And yet we have a 6 to 10 year life expectancy gap between high and low income earners. And tragically, that gap is only increasing. Not to mention a $451 billion in estimated economic burden of racial and ethnic health disparities. Yes, those numbers are incredibly depressing on one hand. On the other hand, as we think about it at Town Hall, that's a call to action and a call to service for our innovators to think about how we solve the hardest problems in healthcare. And so that's what we like to do. We like to back those businesses that we see the potential to be category defining companies with the potential to scale to nationwide models to tackle these incredibly hard problems for communities who've so often been left out of the innovation equation. This often comes in the form of mission-driven entrepreneurs and models that are incorporating purpose-built clinical, behavioral, and social models that we see for most successful companies as aligning around improving outcomes, reducing costs, and importantly, driving high levels of patient satisfaction. And so at our core, that's what we do at Town Hall.
Thanks so much, Anna. Lauren, would you like to come in next?
Yeah, absolutely. Thank you all for having me here today. So I have been in finance for 20 years now. Most of that has been in private equity. Most of that has been in healthcare. And I'd say my reasons for going into private equity are very similar to Anna's. I initially actually thought I wanted to be a journalist, and I went to school for journalism. But what I didn't love about it, while I hear, Anna, what you said about asking the tough questions, and that is certainly true, but at least in my very short time just majoring in journalism, I felt like I was learning a little bit about a lot of things. And what I really wanted to do is go really deep within a particular area. So what I love about my job is the ability to learn so much about an industry, in this case in healthcare. And what I love about healthcare in particular is really two things. One, I love the mission orientation. I love kind of the double bottom line impact that you can have in terms of investing in healthcare and being able to make really meaningful impacts on people and populations. Then the second thing is I think healthcare as an industry is incredibly complex. You have a regulatory environment, a reimbursement environment that is constantly evolving. So for someone who kind of loves constantly learning, always improving, you just have so much that you need to wrap your arms around within healthcare. That I think it creates a really exciting challenge, for people who like an extra challenge. So I've loved my time in healthcare and I've been able to work with really great companies that are improving the US healthcare ecosystem. So a little bit more about Heritage Group. We are a strategic backed fund. Our LPs include 20 large health systems. We have a mix of for-profit, not-for-profit, leading academic medical centers, and those health systems represent about 15% of the hospital beds across the US. We also have 10 payers as LPs, mainly state-specific Blues plans, as well as 2 large nationals. And our payers insure about 1 in 4 Americans. So it's a really broad LP base on both the provider and the payer side. And what we seek to do as investors is really invest in solution-oriented businesses with the thesis that the US healthcare system is challenged. We have ever-increasing costs, which are really unsustainable. And so we like to invest in companies that are taking costs out of the system, that are improving access to care and are improving quality of care. And within that solution set, we're also looking for opportunities where we can add unique value through the strategic network that we've built across the hospital and payer side. So how can we partner with founders and management teams, leverage this network that we've built to help them build a much bigger business than they could without Heritage as a capital partner? So we invest in both growth equity and majority buyout. The underlying companies are very similar, very high growth, typically growing about 50% on the top line when we make our investment. So on the buyout side, even, we're typically acquiring slight control, 55, 60%, really aligned incentives with the management team due to that rollover alongside us, and really generating our returns through typically organic growth as the main lever.
That's really helpful. And Mitch, why don't you bring us home?
Sure thing. So for me, I really do believe that the best work happens at the intersection of humanity and performance. And so for me, it's important when I think of my involvement in the healthcare industry through our human capital advisory services at FMG Leading, I really think about that intersection and how it's tempting for us at work to either focus on performance or humanity. And we really have to keep both in mind all the time. And that's what we do, is we ensure that leaders don't get lost on one side or the other of that equation. And in healthcare in particular, it is decidedly human-centric. And so we can't lose sight of the human side of work. And sometimes it's easy to do that when we're poring over numbers and reports, et cetera. So when we come and partner with investors, we really are thinking especially about the hand-in-glove fit of human capital services and the way that we work on hearts and minds and the focus of healthcare in particular, all the way out to the patient. And so when I think of FMG Leading and why it's a good fit for healthcare investors in particular, I think not only of that, but I also think there's a certain kind of savvy investor that understands that leverage, that understands that it's not really just about the numbers and the reports. As important as all of that is, we're talking about aligning hearts and minds to create value. And that sounds simple in cliche form, aligning hearts and minds, but it's really nuanced and complex and sophisticated. And frankly, I am drawn to exactly that, the human side of this work. And at FMG, that's our sweet spot.
Well, thank you. Again, it's helpful just to hear about the why. The personal why is what drives so much of this work, and to hear from each of the three of you. There's journalism in common, which I didn't know before this conversation right now, so we have that. And journalism is an interesting segue into my next question, because part of why I care about this work is that I have felt, and I believe many of the investors we work with would agree, that the way the media has been portraying the role of private capital in the healthcare system right now is to flag private capital, private equity, venture firms, whatever, as the problem. And you cited a lot of outcomes, expense-related data that describes that problem in a little more nuance, like costs and access and mortality and many other things. And so we'll get into this today, but I'm curious if each of you had just a quick kind of opening statement, maybe a minute or so, on how you would respond to some of that coverage that sort of casts the use of private capital, private equity, venture, et cetera, in that negative light. What would your response be if someone hit you at a cocktail party and said, "This is the problem"? What would you say in response? Would you like to go first?
I'm happy to go first. I was having trouble getting off of mute. So, I think we're all aware of the fact that our healthcare system is challenged, right? We're not really in a healthy place. We have unsustainably rising costs. We have physician shortages. And you can see that from, hospital system operations, right? We've got, months and months of negative operating margins for health systems over the past couple of years. We're now slightly rebounded to very low single digit, positive operating margins. So our healthcare system as a whole is challenged. And if it is as challenged as it is, what we're going to need is innovation to make really significant changes to the care delivery model. And so when I think about private equity's involvement in healthcare and how can we use private equity to fix these problems, innovation really requires a couple things. It requires capital. And a lot of kind of the large healthcare strategics, health systems, and payers lack access to enough capital to innovate, right? So to be able to tap into private equity sources for that capital, I think is really important. And without it, you're not going to have the innovation that we need to positively impact, a pretty challenged industry. So I think that's number one. Two, we need innovation. And to have innovation, you think about just the very traditional innovator's dilemma, you often need that third party to come in and drive that change, right? Because a third party is not hampered by often misaligned incentives. So an example of that would be a health system that's traditionally fee for service, recognizes that value-based care is where things are going to head and you need to invest in value-based care. But that investment in value-based care is going to cannibalize a portion of their fee for service revenue. Right, so you have misaligned incentives with large incumbents, and you need that third party, which can be a private equity-backed company, to drive that innovation. So I think those two things are really important. And the third would be, the media is obviously portraying it as private equity pushing their way into healthcare, but there's also a demand for it, right? There's a demand for capital from health systems to innovate. There is a demand from physician groups to group together. And the reason for that is healthcare has become more challenging. It requires much more technology innovation and sophistication because of things like the adoption of EMRs or the reimbursement landscape becoming, much more intricate, requiring reporting on things like quality and other metrics in order to just get paid. So the technology that you need to invest in is going to be very challenging to do with small kind of underscaled groups. And so those groups are actually pushing for private equity investment oftentimes so that they can get that scale to be able to make the investments in technology so they can just stay afloat, let alone, innovate and kind of create a positive impact.
That's great. Thanks.
I would echo a lot of what Lauren spoke to. And on the last point, I would say the other piece that we consider and I think builds on that is the complexity, the regulatory dynamic, the need to innovate from a technology perspective, the expense of that, human capital management, et cetera, tends to favor the incumbent and tends to favor large when it comes to healthcare. And in order to help shepherd what I think is a much healthier healthcare system of more competition and the ability for folks to stay independent, to practice in a manner in which they prefer to practice, we need support of private capital to help shepherd in that change and support that transformation. The other piece that we think about at Town Hall, and Lauren touched on this a bit, is when we're partnering with companies and thinking about the role that we can play is, what really we're trying to do is help companies take big swings. Those big swings can sometimes be risky endeavors in terms of taking a bet on a new payment model or taking a bet on a new type of clinical model that hasn't necessarily been traditionally reimbursed before. And these are big swings that require, that are very difficult for any one person to scale in isolation. And we can play a part in helping make that transformation quicker, bigger, and de-risked, which I think is incredibly important to continue to attract great entrepreneurs to the space.
Really well said. Thank you. Mitch, what would you add to that response?
So part of this, Matt, comes from real life experience. I have been cornered in some dinner parties and asked, what are you doing working with the bad guys, right? And so this is very, it's very real to me, not just because of the personal anecdotes, but I do believe, the narrative is that there's good guys and bad guys. And I think private capital, especially private equity in particular, is getting scapegoated in a much more complex and nuanced conversation than just there's good and bad. It's not a binary thing. It's so much bigger than that. And I would say, if you think of private capital as a tool in the toolbox of those that are rebuilding healthcare, then it makes perfect sense in certain situations. Not every situation, but in certain situations, it's exactly the right tool to build on what Anna and Lauren were saying. I mean, the innovation, the focus, the healthy pressure that comes from that, it can be exactly what's necessary. And I've certainly seen that with many of our clients.
Yeah, really well said. Appreciate the
only other nuance I would add, just reflecting on that comment, is it is partially the responsibility of private capital partners to not just tell better narratives, but to actually put those better narratives into practice. It's our responsibility to partner with companies in a responsible and effective way. And so in some ways, I put the challenge back on us to say, how can we ensure that we're doing, as Mitch aligned, where humanity and innovation can intersect? I think that's massively important, and in some ways on us to be responsible stewards of that.
Yeah, that's so well said. And it's easy to focus on the micro and miss the opportunity to tell a compelling story. There's something missional behind the majority of the investors we end up getting to know. And I hear it in both of you right off the bat. You can see a problem that is human by nature, economically easy to measure, say, what's our role in changing that? And obviously, both of the firms you each represent and the many that you work with, Mitch, have some unique ways of going about that, right? You're structured differently. You pursue folks at different levels of evolution or growth stages. I'm curious to maybe have a little bit of a follow-up. How do you, without sharing the trade secrets, how do you inside your firm find the areas where you choose or want to invest? Where in the underwriting process do you get focused on a sector or a segment where you think you could really add significant value?
I can start on that one. So we take a very thematic approach to investing. The way our firm is structured is we work very closely with our strategic LPs and have a really programmatic way that we engage with them. And the purpose of that engagement is to understand what's strategically relevant to them, what are their pain points, and what are of that kind of universe of pain points, what are the ones that they're not going to be able to solve themselves, where they're going to need to partner with external companies. And so because of the breadth and depth of our LP base, we're able to compare all of those conversations and drill down into the commonalities to identify what are those subsectors within healthcare that are positioned to benefit from disproportionate demand and growth. And so those are the areas that we look to focus. At any given time, each of us as partners is going to be working on typically 2, maybe 3 distinct themes where we're doing proactive research, proactive outbound outreach to all the companies within that sector, understanding the market landscape, and ultimately trying to identify a company that has a really differentiated clinical model, has a differentiated product platform solution, and is positioned to be a winner within that subsector. So at kind of the highest level, we're figuring out where we want to invest based on where we see the pain points across the healthcare system, which is really informed by our strategic LPs.
I'd echo a lot of that same sentiment that Lauren described. We similarly take a thematic approach, often starting with, let's identify really huge problems in need of really huge solutions, and start there. Building on where Lauren is, one of the things that we like to think a lot about is how do we help solve those solutions through partnership, often with some of our strategic LPs as well as the ecosystem writ large. I had one of my founders describe to me that sometimes she feels like she's trying to sell a car when all people are used to buying is the fastest horse, meaning we're trying to solve the same problem here. We're just coming at it from different points of view. If you think about healthcare in this country, the government, starting at the top, the government leading all the way down to large enterprises, et cetera, has basically asked the private sector, nonprofits, et cetera, to be partners in innovation. It's not an optional, it's part of a mandate. And what we like to think about at Town Hall is how do we help shepherd that partnership? We don't have a problem of people not wanting to do the right thing. We have a problem of challenges, and there's no lack of great ideas in healthcare. The hard part is how do we scale and how do we scale sustainably? And so what we try to do at Town Hall is take both a visionary, like what are the huge problems approach, as well as a tactical and practically what do we think can actually get done, often through partnership. And that tends to be where we like to place our bets, when we see the intersection of those two coming to life.
I love it. Mitch, what would you add, again, based on your survey, the landscape of the various clients you're seeing these days?
Matt, it's definitely from a different angle, because as we work with investors, we're working with people like Anna and Lauren. And frankly, we're drawn to people who, I hate to use the cliche, but it's like they get it. And by that, I mean, we don't have to convince them that this isn't supplemental, nice to have soft skill stuff to make people feel good. But instead, they understand that things like fear and hope, ego, greed, generosity, politics, power dynamics, personalities, all that actually is in the mix here. And so when we're working with leaders and teams and boards, and we're trying to help them get aligned, get realigned, stay aligned, clean up messes that often happen at the bar over drinks, meaning the two people are having a conversation about a key thing that actually should involve 12 people. And they show up at the next meeting and they've sort of all made all these decisions without the right people. Like, that's messy human stuff. And that's where we come in to make sure that the right people are having the right conversations about the right things. And that sounds much easier to do than it actually is when you're talking about, Anna, I'm going to borrow your word, when you're shepherding real human beings who have a mind of their own and who are pulled and pushed in all sorts of directions. So when we're picking a partner to work with, we love to work with investors that we don't have to convert to that mindset, but instead they get what we do and they invite us into the middle of it.
Super. You kind of got to this, and so I'm going to bring this question up from a little bit later in our queue. How is the concept of value-based care influenced or currently influencing your investment strategy? Where do you think about places you can bring value as the industry wrestles with some of these models?
Look, by latest estimates, I think the Medicare Trust Fund is done in 2036. I don't want to reveal my age, but that's before I have access. And so we just have a fundamental problem in the country where we have to think about how to deliver care more efficiently, more effectively, with both better outcomes and lower cost. Conveniently, we actually know how to do this. We're not trying to reinvent the wheel. We know the types of interventions that are underfunded when it comes to thinking longitudinally about a person's well-being. And so what we love to think about when it comes to value-based care isn't value-based care for the heck of it. Any number of companies pitch us saying, and we're going to do value-based care, and that's great. what we like to think about is how is value-based care, great sometimes, not all the time, sometimes. What we like to think about is how is value-based care an enabler to actually be able to do sustainably the type of work that we know has the greatest impact on a population's health, particularly populations with complex conditions, populations for whom addressing not just what happens within the four walls of the hospital, but addressing what happens in the remainder of someone's life can actually have a much greater impact on those outcomes. And so that's what we love to think about when it comes to value-based care, is an accelerant of that transformation by creating the right financial incentives to do the behaviors that we know need to happen in order to holistically think about building a sustainable and healthier healthcare system in the country. And so that's where value-based care comes into play for us, is, again, for models for whom it's appropriate, being able to build sustainably and create differential advantages to get paid for stuff that otherwise is very, very challenging to get paid for, but that we know is incredibly important to driving a better holistic healthcare system.
Well said. Lauren, what would you add?
Yeah, I mean, just to ladder onto that, I agree with everything Anna said, and I think we think about it pretty similarly at Heritage. We've been investing in value-based care for a long time. And I think some of the investments we made early on and in Heritage were maybe a little bit too early. Whereas now, value-based care, I think there is kind of a wider agreement that that is where things are headed. But I still think that there are a lot of challenges around getting paid, for that work. And so as an investor, when we think about value-based care, we're very focused on, do we feel like the unit economics are going to work for this business? Do we think that there are payment mechanisms where you're going to be able to get paid for driving those outcomes? I think where it starts to get really challenging is as there's been this proliferation of value-based care entities, some of which are whole kind of population-based, some are condition-specific models. It becomes really challenging for, whether it's the government or it's a private Medicare Advantage plan or anyone really at risk, to be able to carve out and capitate all of these different slivers. So that is the piece that can be challenging. How do you kind of carve out MSK value-based care risk when you already are carving it out to, a group who's taking risk on a total population? So it is challenging, and you need to make sure that there are kind of the payment mechanisms in order to build a real business around it.
Again, well said, and not simple business problems at all that you're both describing. Mitch, as you sort of think across the FMG leading ecosystem and the number of clients we're seeing, what would you add about the way in which investors are beginning to foray or continuing to foray into value-based care?
So for me, what I've noticed is that the investors who are willing to pause and basically be candid with themselves and others, that we're talking about a fundamental shift in people's beliefs and behavior. We're not just sort of tinkering from the edges. And so when we're talking about shifting human beliefs and behavior, it's a massive enterprise unto itself. And so these are the conversations that we're trying to help them have. It's sort of, you could fall into the go slow to go fast, but it's bigger than that. It's actually, it's understanding that we're trying to convert the way people think about what the future needs to look like. And that is, that takes a lot more effort. I often use the metaphor of golf. It's like, you walk into the tee with a 4-iron, you need to go back and get your driver. This is a much bigger, longer drive than most people can imagine.
Yeah, and I think it requires, to your point, Mitch, patient capital, like long-term capital, because for a couple of reasons. I mean, one, it just takes a long time to see the outcome of the effort behind value-based care, right? So as you take on a new cohort, you're not going to know how you're performing for the first 18 months. And even then, it takes a while to be able to start working with a population and have a meaningful impact on total cost of care and on outcomes. So it really requires that kind of patient capital approach. And you see that, with companies like Oak Street, right, which was private equity backed and then was public and now is owned by CVS. And now they're looking at do we need private equity, help in managing this asset and helping it to continue to grow? So it certainly is an area where you need to have that kind of patience and understand how long the journey is before you can really kind of prove out the results that you've made on a population.
I also think it's an area where, because of the delays perhaps between the actions that are being taken and seeing those results, coming in with a point of view and with an expertise and with an ability to de-risk, like we try to do at Town Hall, like I know Lauren does at Heritage, can really be, I think, critical partners and a critical ingredient to helping companies succeed. It's very hard to do this at scale. And in order to be, I think, an investor who can play well in this space, I think having those decades of experience, having the ability to look forward and know what's coming down, I think can make you a differentially viable partner for companies undertaking what are, to Mitch's point, is a really big and important transformation. And so I think this is where we think specialization can be helpful as investors, where we think commitment to longitudinal partnership can be helpful, and where we've seen investors really be able to make a difference in outcomes.
That's well said. We've sort of covered the strategy landscape and talked a bit about the why. And this transition question is one of my favorites in these kinds of conversations, because I would imagine between the three of you that we could think of a couple of dozen, if not more, real life stories, right, of specific investments or specific cases where you've seen a really great alignment between a financially viable business growing and a real problem getting solved, sort of missional impact. So I'm curious if you'd share an example or two from your background, or even recently, that would put some of these theories and principles out there in real life.
Matt, I think one of my favorite more recent stories is one of our clients, a startup in a sector of healthcare that has just been brutal, managing all the what I call the typical keep you up at night problems. So like problems coming from every direction: the board, the market, the management team, the organization, the tension between clinical quality and speed of growth, et cetera, et cetera. And I was having a conversation over dinner with this CEO, and I asked him, how do you keep this human focused? I mean, like, these are all pressures that are compressing you and your team. And he smiled and he said, well, one of the things that we're doing, I'm not sure that this is like the answer to your question, but I know that it sticks out to me, is we always tell a story. Every time the executive team is together, we always tell a patient story. And so we pour over our reports, but then somebody gets to tell a story. And he actually told me one of those stories, and he was tearing up as he was telling the story about this incredible gift that came to one of their patients. And he kind of, the finer point to the end of that, Matt, was when he said, yeah, so we don't just look at numbers, we remember names. And to me, like, that's a really good example of a great leader who's managing the pressure. He's not just focused on profit, but very much on purpose as well.
Yeah, well said.
I'm happy to give one. And Matt, if you want us to give more than one, feel free to circle back to me at the end, because I have a couple that I could give. But as Mitch was speaking, it reminded me of one of our portfolio companies, Upward Health. So in the value-based care, space, so relevant to the conversation we've been having so far, they're managing complex populations, typically the costliest 5% across Medicare, Medicare Advantage, and Managed Medicaid. And these are typically, semi-homebound populations, multiple chronic conditions, and they're providing home-based primary care and partnering with plans to take risk on the total cost of care on these members. We start every board meeting with a patient story, and the management team also starts every, one of their executive get-togethers with the patient story as well. So it's always kind of keeping the mission at the forefront, and this is why we're doing what we're doing. Most of those stories are, pretty tear-jerking, right, of ways that Upward has been able to make a really meaningful impact on these people's lives. But from a financial perspective, as you think about kind of marrying the kind of financial performance and, success with kind of the human element of that double bottom line, they've been able to structure really great contracts with payers that are paying them for all the great services that they're delivering and helping them to generate a really nice cash gross margin, right? So removing some of the issues with value-based care, of not seeing those value-based care payments for 18 months after, you kind of started with the cohort. So very strong financial performance, but really great impact on populations. And one thing that they've done, which is pretty neat, is they've also started a nonprofit organization. So that when their care specialists who are in the home with these members see some kind of social determinant of health, some kind of barrier to that person accessing healthcare that can't be reimbursed under traditional payment methodologies with Medicaid or Medicare Advantage or as a dual, the nonprofit can fund that. So it's been things like a patient needs an air conditioner, right? They're an asthmatic and they can't figure out how to get payment through Medicaid, for this. The nonprofit arm of Upward can fund that. Or you've got a patient who has been very ill, has been having trouble getting to work, and so they've just gotten behind. They've gotten behind on rent, and it's having a huge impact on them, on their continued health, and on their mental well-being. This nonprofit arm will pay that back rent to get that person back on their feet. So a really great kind of, weave between kind of the for-profit aspect as well as kind of the nonprofit pieces as well.
That's a great story. Yeah, I bet you have one or two.
Yeah, I'll tell one to add a slightly different perspective, which is one of our behavioral health companies that's really focused on bringing high quality outpatient, called Brave Health, focused on bringing high quality outpatient support primarily to low income communities through partnership with health plans. What I'll talk about with Brave is, I could go on about the demand for behavioral health services. I could go on about the disparities in access between Medicaid populations and others, and go on about all of it. That's all real, and that's all part of the thesis behind Brave. One piece that I think has really enabled Brave's success is when we think about core challenges in behavioral health, finding demand isn't hard. We have way more people who need service than who are able to get service today. So instead, the way really the Brave team has rethought about this problem is they need to become a employer of choice for providers who are interested in serving a patient community that is in need of service. And so they've tried to flip the script a little bit to say, we know we can get demand and we have a repeatable way to do that. What we need to do is really build for supply. And so retention ends up being one of, if not the most, clinical retention ends up being one of, if not the most important metric that the Brave team thinks about. And how do you do that? It's not easy. And it can't just be paying people more. That breaks from an economic model. And so instead, it's a series of small incremental things that end up making a difference from how do you show people that they're appreciated? How do you provide people with critical education and career development? How do you provide technology to make the clinicians' lives a little bit easier? It is so hard to practice medicine today. How can we make their lives a little bit easier? And as a result, the company continues to have incredibly high NPS for patients, and importantly, continues to see better and better retention from their clinicians as they've invested behind creating a really ideal clinician experience. And so I think you end up seeing this in all dimensions. Without clinicians, Brave can't exist. And so I think continuing to recognize that they're at the heart of what makes the company special has been really important to their scaling.
And so those are great stories. And it brings to mind one that I wasn't planning to share, but I think it's actually really relevant, especially to what you said, Anna. I've been working with a firm now through 3 separate financial sponsors, and they're focused on OB care. They provide OB emergency departments to sort of, second geographical tier hospitals outside of the major metro areas, and have now become, I'm not quoting anything, off their website, but probably the largest employer of OBs. And the play there is around recognizing the various stakeholders, right? We talk a lot, and this conversation seems to be focused on the sponsor and the firm, but you've got all these other stakeholders that have to be in harmony, and recognizing that if we can become the place where OB docs want to come and practice medicine, believing in what they do, recognizing that as a firm, they can take down the C-section rate single-handedly, right, by driving different kinds of clinical engagements. There's something about recognizing that when you've created a business where people are proud to affiliate, proud to work there and say, where else would I want to work? If I want to practice medicine the way I was trained and called to do it, I'm going to work in this firm. That's sustainable long-term value. And I think to highlight that point, 3 separate sponsors we've been involved with there are continuing to see that move along. This isn't a one and done. This is a building a business for all the right reasons. Those kinds of stories are awfully inspiring. Connected to that idea, there's alignment, right? So alignment between your LPs who really recognize what you're doing and choose to invest capital with you, alignment between yourselves and the management teams and the various stakeholders in their communities. What are some of the alignment risks that you look out for when you're engaging? And you've alluded to them a little bit already, but what are the engagement risks or the alignment risks that you look out for, and how, if at all, do you address them early in an investment?
I get asked this question a lot because we have strategic LPs. And so, and primarily it's almost entirely strategic LPs. And so I get this question around alignment a lot because there's a lot of potential friction that could happen. So on the one hand, we have both payer and provider LPs, right? So we're going to invest in some companies that are maybe very payer friendly or maybe very provider friendly, but maybe not both. And so for us, it's really about being very clear around those potential areas of friction before we have an LP join the fund, right? Recognizing that we're going to invest in some things that are very relevant to them and some things that might not be relevant to them. I think it's the same when you're working with the management team. It's being very upfront around. So a lot of our founders, this is their first time working with private equity. So we try to be very upfront around and really hand-holding around what it looks like to work with private equity. What are the things that are going to change, once you move from being kind of a founder CEO to a private equity-backed founder CEO? What is that going to look like? So I think a lot of, kind of aligning incentives is around being really transparent at the outset of a relationship. I think that's one of the most important things.
So in some ways, I think when we're doing our job best at Town Hall is when we're investing in companies where this actually becomes sort of a moot point because the business does well. Therefore, our limited partners are happy because we've delivered upon our promise to them, which is one of returns, because of the impact that they're having, positive impact they're having in the communities that they serve. Now, it's not always easy and not always up and to the right and not always rosy. Like I'm not sitting here and saying, yes, every contract is perfect and every market is viable. And we've had companies that have had to exit an early market because they couldn't continue to perform sustainably in that market. Of course, these things happen. But generally, when we take a step back, I think that upfront communication and being really clear about what we bring to the table as Town Hall is critically important. Primarily because if there isn't alignment from a performance and a way in which we think the world should be perspective, we're probably not the right partner, honestly. And so I think, again, when we're at our best work, it's when the tension sort of becomes a non-issue, frankly.
Yeah, that's well said. And Mitch, you could probably write a book on this question because we wouldn't have a career if there weren't this alignment to engage with. But what were some of the risks you would see or call out, and some of the ways to mitigate those?
Yeah, we all know the famous real estate location. Well, in my work, it's alignment. And I guess the best way to tell that story is the risk that I often see is that people think that mostly aligned is good enough. And it's a recognition that alignment is actually, to quote a teammate of mine, alignment's a binary thing. You're either aligned or you're not. And so like mostly aligned is something that, in fact, now it's sort of a red flag. When I hear, whether it's LPs, investors, a management team, or one or some combination thereof, if they use that phrase mostly aligned, it's like we know we have a lot of work to do. And unfortunately, most of the investors that we work with do think that that's good enough. And so we end up cleaning up messes on the back end of alignment that if we had been invited in earlier, when we could have created alignment early and more succinctly and more explicitly, we'd solve a lot more problems that way. So the risk is definitely mostly aligned is not aligned.
Yeah, one of the classic concepts behind private capital or private equity transactions is the idea of alignment of incentives. And you hear that term a lot. And I would just add to what Mitch said. It is often the case that when you use the word alignment, do we have a good capital structure that makes sure all the people that benefit from the financial success of this business are driving such success? And I would raise the flag that says, do you understand that alignment is created in more ways than just a cap table, right? Are there additional things that you need to do relative to what mission looks like, or what simple things like strategy and capabilities planning are required to actually ensure you deliver on that? Because if I had to critique the investment community, of which I'm a proud member, a little bit, it would be recognizing that if we just align everybody's financial incentives, this is all going to work out just great. And at the end of the day, that's far from true, especially when you're dealing with nuances like what you've both just described in terms of such complex businesses with big challenges ahead of them. We're getting close to the end of our time. Unfortunately, we have about 8 minutes left, and I want to give you a chance to answer this question however you would do best. But it's really simply, how do you define a successful investment? If Heritage exits, if THV exits, or Mitch, if any of the firms you're working with sort of deliver that firm to its next capital structure, next sponsor, next stage of its growth, how will you know that it's been one of your very best and one that your team is proud to have been involved in? What would you say on that topic?
We're trying to back category defining companies at Town Hall. Right now across our portfolio, we serve 4 million lives. That's a great number. That number should be 40 million. That number should be 80 million. The way we get there is by continuing to back companies that have the ability to scale, have the ability to impact, and the ability to do so sustainably. And so for us, when we look at our most successful companies, it's those that are taking on, I feel repetitive, taking on these really hard, gnarly problems, doing so by investing in best-in-class care models, supported by best-in-class business models, and ultimately able to scale to impact, well beyond, frankly, what usually we underwrite is what gets us excited.
I don't have a ton to add to what Anna just walked through. I think there's a lot of similarities between our two firms. We're also solution-oriented businesses, so we think about our successful investments is everything Anna just walked through. And then also, we want to feel, which Anna does as well, like we have been a good partner to that company. And so a big kind of metric of success as well for us will be, did we help that business grow? Because they partnered with Heritage, are they a better business now as we sell them than they would have been if they had gone it alone? So that's something that we track pretty closely internally, or what are kind of the key things that we did, whether it's using our network to help them build out their management team, to either top grade existing management team members or filling gaps from a function perspective that they didn't have. How were we able to drive growth by creating that connectivity between our network and our strategic LPs and that company? So really feeling like we had an impact on helping that management team and helping that company be better than they would have been without us as a partner.
Well said. Mitch, in your survey, what would you add to that?
I would say when there's no losers. And so by that, I mean that everyone feels like value has been created for them. So in healthcare, that's for the patients, it's for the employees, and for the owners, right? And so I firmly believe that when we're investing well, that's exactly what we're shooting for. And to me, that's a successful exit. We do some, what I would call exit coaching. So we'll sometimes get called in, 6-12 months before an exit. And if people haven't been thinking that way all along, it's actually too late, right? And so like the best successful exits start at the very beginning with a win-win-win in mind there.
Yeah, I'll add to that, just having been around this space for a while, you also find over time that executives become so grateful for the experience to partner with a firm that they choose to stay in that ecosystem. They treat it like an extended family and say, hey, what are you doing next? CFOs and CEOs and marketers stick around to say, I like the way value is created here. I like partnering with these investors. They see more broadly and they begin to think of it as a career. And I know that's sort of a holy grail to say, how do we get a management team to do something like this with us again? But there's a sense of mission that really underlies that. How do we do well, do good, and do it all at the same time?
There are two types of referrals to Town Hall that I'm the most proud of. One is when we have early employees from our investments who are looking to their next thing, who are looking to start something and are thinking about who they want to be their partner. I love when they call us. When they don't call us, I consider that that means we're not doing our job. And so that's probably my first favorite. My second is we'll pass on way more companies than we invest in. That's sort of the nature of our model. My favorite referrals are actually from those entrepreneurs who we've passed on because we were able to add value and they felt like we were conscientious and good partners to them, even when we didn't end up investing. Those ones probably make me the most proud when we get those because it means we're doing things the right way. And so to your point, like you can, I think, really create great alignment and hopefully be able to, you see the fruits of it on the other end. So.
Well said. Lauren, you have a final comment or statement you want to make?
No, I don't think I have anything to add. I think from an investment standpoint, this whole concept of alignment is always important to us, even around the underlying business that you're investing in. So thinking about companies that are improving patients' lives and are also helping health systems and helping payers, there are companies that are able to kind of help each of the major players within the ecosystem. There's actually one that both Anna and I are invested in, a company called Connections, where they are helping health systems deal with very, very sick behavioral health patients that show up in the emergency department that shouldn't be there. And they're taking care of those patients in transition. So it's helping the health system improve efficiency of their operations so they can provide better care. It's improving the lives of the patient that are in crisis. And it's also helping payers find providers to care for these, very complex behavioral health patients. So I think that the best investments are also ones that have that alignment across the healthcare ecosystem.
That's really well
I was hoping you were going to mention Connections, Lauren. It felt like it would have been a mistake for both of us to be on this call and not have that company come up. So I'm glad you did.
Indeed. Well said. Well, I just want to say the purpose of this conversation was to start a different kind of dialogue, one that stands at least as another point in this question of how private capital could drive transformation in the healthcare system. It's not just what you're reading in the news media or hearing debated on the floors of Congress. There are real people thinking missionally about how to put capital to work to drive change that wouldn't happen any other way. I know there are many folks engaged now who have questions or comments they want to add. We are collecting those and we'll read them and we'll do our best to respond or funnel them in the right direction. Thanks for bearing with us on that. And thank you to our panelists and to all of you who chose to spend your lunch hour, at least here on the East Coast, with us. We're grateful for the chance to partner, and I'll turn it back over to Vishesh, who will bring us home.
There's a lot of people still in the audience. We're very grateful that you stayed with us till the end. Of course, you can join us again on themiddlemarket.com to get this conversation, a summary of this conversation, but also future conversations in this vein. Thank you so much for taking the time to spend with us today, and have a great week.